All right, today we're going to talk about a medication you've probably heard of, levofloxacin. Maybe you know it as Levaquin. Now, this is an incredibly powerful antibiotic, but, and this is a big but, that power comes with some really serious considerations. So let's unpack it together. We're going to look at what it is, when it's used, and most importantly, what you absolutely need to know to use it safely.
So let's start with a basic question. What happens when a bacterial infection isn't just, a minor annoyance? What if it's something truly life-threatening, like a really bad case of pneumonia, or even something as scary as anthrax exposure? Well, in those situations, doctors need to bring out the big guns. They need a heavyweight tool in their arsenal. And that is exactly where a drug like levofloxacin enters the picture.
Okay, so here's what we're going to cover. First, what exactly is levofloxacin? Then, we'll get into what kinds of infections it fights. After that, and this is super important, we'll dive into the black box warning and other major risks. Then we'll switch to how to use it safely, and we'll wrap it all up with the bottom line.
All right, first up, what even is this drug? Let's get to the bottom of what makes levofloxacin such a, heavyweight antibiotic.
So, levofloxacin belongs to a class of antibiotics called the fluoroquinolones. You can think of it as a broad-spectrum weapon, meaning it works against a huge range of different bacteria. Its whole job is to get inside a bacterial cell and totally mess up its ability to copy its own DNA. And if a bacteria can't multiply, well, it's game over. That's why this drug is so darn effective against really aggressive infections.
Okay, so we know what it is. Now let's talk about when it's actually used. And let me be clear, a tool this powerful is not for your everyday sinus infection or common cold. Its purpose is super targeted, and it's all about balancing that incredible power with a very specific purpose. Yeah, as you can see, this list is for some pretty serious stuff. We're talking about tough-to-treat pneumonia, including the kinds you can pick up in a hospital. We're talking complicated skin infections, kidney infections, prostate infections. And then there are the really critical situations, like exposure to inhalational anthrax or even the plague. In those cases, levofloxacin is an absolutely essential tool for public health officials.
But here's where things get really interesting, and it shows a big shift in medical thinking. For a long time, this drug was also handed out for more common stuff, like sinus infections or bronchitis. But because of the risks, and we're about to get into those, the FDA has put its foot down. The official word is now, for these less serious infections, levofloxacin should only be used as an absolute last resort, when nothing else will work.
Okay, this brings us to probably the most important part of this whole discussion, the black box warning. You really want to pay attention here. When the FDA puts one of these on a drug, it is their highest, most serious level of alert. It's basically a giant red flag meant to draw everyone's attention to potentially life-threatening risks.
And the language the FDA uses is incredibly direct for a reason. They talk about disabling and potentially irreversible reactions. Let's just let that sink in. We're not talking about a temporary upset stomach. We're talking about side effects that could potentially be permanent. And, what's more, a person can experience several of these serious side effects all at the same time.
So what are these risks? Well, the warning focuses on three main things. First up, your tendons. Think inflammation or even a complete tear or rupture. The most common one is the Achilles tendon in the back of your ankle, but it can happen in your shoulders, hands, anywhere. Second is nerve damage, what's called peripheral neuropathy. This can show up as pain, burning, tingling, or numbness, usually in your arms and legs. And third, there are effects on your central nervous system, your brain. This can range from confusion and hallucinations all the way to serious depression or even seizures.
So is this risk the same for everybody? No, not at all. The risk of a tendon rupture goes way up for certain people. We're talking about anyone over the age of 60, people who are also taking steroid drugs like prednisone, and patients who've had a kidney, heart, or lung transplant. And on top of that, things like doing a lot of strenuous physical activity or already having a condition like rheumatoid arthritis can also bump up that risk. And as serious as that black box warning is, it's actually not the whole story. There are other major risks to be aware of that go beyond just the tendons, nerves, and brain.
It turns out levofloxacin can weaken connective tissues throughout the body. So just like it can damage tendons, it can also affect the aorta. That's the main artery coming from your heart, which increases the risk of a very dangerous tear. It's also been linked to severe liver damage, sometimes even fatal. It can mess with your heart's rhythm in a dangerous way. For people with a condition called myasthenia gravis, it can make their muscle weakness much, much worse. And finally, it can cause wild swings in your blood sugar, which is obviously a huge deal if you have diabetes.
Okay, I know that was a lot of really heavy information. So let's shift gears now and talk about the practical stuff. What can you do? How can you be an active partner in your own safety if your doctor prescribes this medication for you?
This is probably one of the most critical things to get straight. You need to know the difference between a common side effect and a serious warning sign. So stuff like nausea, a headache, maybe some diarrhea. Yeah, they're annoying, but they usually aren't a red flag. But the things on the right, that's a completely different story. Any sudden pain or swelling in a tendon, any numbness or burning pain, sudden severe pain in your chest, stomach, or back, or signs of liver trouble like dark urine or yellow skin, these are not wait-and-see symptoms. These mean you call your doctor right away.
Okay, let's talk about one of the biggest and most common mistakes people make when they take this medicine. It all comes down to timing. There's this process called chelation, which is really just a sciencey way of saying that certain minerals can literally grab onto the antibiotic in your stomach and stop your body from absorbing it. And if it's not absorbed, it can't fight the infection.
So here's the golden rule, and it's all about timing. If you take antacids, mineral supplements like iron or zinc, or even just a multivitamin, you have to space them out from your levofloxacin. The same goes for dairy products or fortified juices. Just remember the 2-hour rule. Take your levofloxacin at least 2 hours before or 2 hours after any of those things. It's that simple, and it's that important to make sure the drug actually works.
And it's not just supplements and dairy you have to worry about. There are some really significant interactions with other prescription drugs. For example, it can make blood thinners like warfarin work too well, which increases your risk of bleeding. If you take it with common pain relievers like ibuprofen or naproxen, it can actually increase the risk of central nervous system problems like seizures. We already mentioned how it can mess with diabetes drugs and certain heart rhythm meds. This is exactly why it is absolutely 100% non-negotiable to tell your doctor about every single thing you take.
Okay, we've covered a lot of ground: the power of this drug, the very serious risks, and the practical steps for safety. So let's just pull it all together. What's the big takeaway here? What's the bottom line on levofloxacin?
Really, it all comes down to balance. There are two sides of the same coin. On one side, you have an absolutely essential, life-saving medication that we need for some of the worst infections out there. But on the other side, you have these very real, potentially permanent risks that you have to respect. It's a textbook case of a powerful tool that requires a real partnership. A partnership between the doctor who knows when to use it and the patient who knows how to use it safely.
And that really leaves us with one final thought. Just understanding this balance between benefit and risk, that's step one. The real challenge is turning that knowledge into action. So my question for you is, now that you know all this, how can you be a truly active partner with your healthcare team to make sure your treatment is as safe and as effective as it can possibly be?